Welcome to Dr. Corey Kingston and our online webinar guests to this month's Ask the Expert webinar. I'm Jan Chambers, President and founder of the National Fibromyalgia and Chronic Pain Association. Thank you, Dr. Kingston, for your technical savvy here at the last minute. It's a pleasure to have you as our guest. I appreciate your accommodations to come to our office and expand the webinar so that additional people who wanted to register in the last 24 hours can participate. We look forward to learning about your research on the neck in fibromyalgia. A lot of people have significant neck pain with fibromyalgia and would like to understand more about the correlation that you see between the neck and fibro. Dr. Kingston received his doctorate degree from Palmer College of Chiropractic in 2000 and has been a researcher in his Logan, Utah office for several years. His clinical study on 26 patients in 2009 was at 2 separate locations over 12 months. It showed strong and positive improvements for fibromyalgia symptoms and pain. I'd like to turn the time over to you now, Dr. Kingston.
Thank you, Jan. Okay, so because of timing and things, I'll keep it a little bit shorter on talking about my past and how I've come to love fibromyalgia and love fibromyalgia patients and be able to help them in a lot of ways. Story short, I looked all over the country. I looked for something that could show me that they could, on a pre and post x-ray, that we could actually show some kind of objective result with what we were doing. Because a lot of times the patient felt better, but they weren't permanently corrected, and that's what I was looking for. And through lots of searching and putting different things together and just going out and finding bits and pieces and things, we were able to put together a program where we were able to get results and able to get permanent results, where a person can come in and we take an x-ray and we put them through the program, and at the end of 6 months or 3 months or whatever their program was, that we could show that all of the mechanics in their spine were actually corrected. And we're talking things like disc bulges and problems like that are major problems. All these different biomechanical disadvantages were actually corrected. You could see that on a pre and post MRI. You would see that the disc was healed. And we were really excited because we were able to do things that weren't being done up till then. Well, one thing that I noticed with this is that a group of patients that I had stopped accepting as patients who had fibromyalgia were starting to get better. Because before, when I was doing just the regular chiropractic work and the stuff that I was taught in school, a patient would come in who had fibromyalgia, and usually we would just flare them up. I was pretty ignorant to what fibromyalgia was all about. I just thought it was a rheumatological. So as we started to do this new program and this rehabilitation technique with the spine, and we're able to restore different things, we started to see that patients who had fibromyalgia were responding to this treatment. And not only were they responding, that they were responding in a very, very quick manner and also a very, very effective manner, where their pain was going away and their brain fog was lifting and their anxiety was lifting, and their symptoms in their stomach were going away, and their joint pain and all of these different things, the inability to go to sleep at night when you lay there and your mind just races over and over and over. It was going away, and people were getting sleep like they were supposed to. And I was really perplexed by this, because I thought, how can someone who has a rheumatological disorder called fibromyalgia, how could this be affecting them if what we're doing is correcting their neck? And so I started to do some research, and I went to pubmed.gov, which is the government's website for, you go to that search place at PubMed and you can type in keywords, and it will pull up only refereed journals, only peer-reviewed journals and articles that way. So it's a really good source to find really proven things. Well, if you type in cervical spine and fibromyalgia, there's not a lot out there that's been done. There's a couple studies that I'll go through here in a little bit, but there's not a lot out there. But if you go in and you type in all these different symptoms like brain fog or joint pain or this pain that's all over in your skin that when someone touches you it just hurts like crazy, all of these different kind of odd symptoms that fibromyalgia patients have, if you type those in individually with the word cervical spine, then you find 20 to 30 articles for all of these different things. And when I saw that, the light bulb just kind of went on and went, okay, fibromyalgia could be caused in many instances from cervical spine issues. And so we started to look into that more and more, and that's what I want to present to you today, is basis to what we're doing and we'll show you some of the pre and post results that we're able to achieve. We'll also go through all of the history as it relates to the cervical spine and fibromyalgia, and I think that you'll see that there's a lot of aha moments that you might have as you're going through this, as you can relate to what I'm talking about. So this is usually a webinar that I'll do that usually takes anywhere from an hour to an hour and a half, and so I've cut this down to fit into the schedule to about 45 minutes. So bear with me as I talk really fast and try and get through as much material as I possibly can, and then at the end there's a question answer period that we'll do as well. So fibromyalgia and the cervical spine, what is the correlation? Okay, so as I started to look at what the correlation was there, and I started to look at the history of this, I came across a video. This was done on ABC Primetime, and this was a video that was put out clear back in like 1999. Okay, and I'm hoping this will play for you and go through, and I'll explain it to you as well. So I'm going to play this first little clip.
Dr. Banner began to wonder if what he had, chronic fatigue, could actually be treated with surgery. Like so many patients, he had been going to internists or rheumatologists who think of causes like infection or immune diseases. But Dr. Rosner, a surgeon, was looking at the central nervous system and finding that some patients like Dr. Banner, who had been labeled with chronic fatigue or fibromyalgia, instead had the classic treatable conditions called Chiari syndrome or cervical spinal stenosis. In Chiari syndrome, the opening at the base of the skull is small and compresses the brain as it narrows and passes through to become the spinal cord, the vital roadway that carries all the nerves to the body. And in spinal stenosis, that spinal cord is compressed by surrounding bone. Neurosurgeons have long known that compression of these areas can cause debilitating neurological symptoms throughout the entire body, including pain and weakness. Dr. Banner immediately got an MRI, and just as he had hoped, he actually had narrowings that could be corrected by surgery.
Okay, so Dr. Banner is a rheumatologist, and he develops fibromyalgia so bad that he isn't able to practice. And so he starts looking for different things that might be going on, and as he's reviewing records, he notices that people who have this cervical stenosis have this stretch on their cord and different things going on that you can see in many cases on an MRI, that they were having the same symptoms that he was having with this fibromyalgia. So just to make the story a little shorter, he looks up Dr. Michael Rosner, who is the leading neurosurgeon in the country for these kind of surgeries for Chiari syndrome, cervical stenosis. He's one of the leading surgeons. So Dr. Banner went down and talked to Dr. Rosner and asked him to do this surgery on him. And long story short, they ended up doing the surgery, and Dr. Banner came out of the surgery, and he no longer had fibromyalgia. And so they thought, wow, there's something going on here. They did more. Dr. Rosner did countless research things. He published some papers and stuff regarding this, and he started to do a lot of these surgeries, and they were having some good results. In fact, this next clip.
It's like wearing your belt too tight. And the surgery is designed to loosen the belt. Like Dr. Rosner, he too now believes that some patients labeled with chronic fatigue and fibromyalgia have the same compressions. It sounds very straightforward and almost mechanical, and in a sense it is. It's a mechanical problem. There's a mechanical solution. In fact, the mechanical solution is the same delicate surgery that has been done for decades. An incision is made at the base of the skull and the base of the neck to remove some bone around the brainstem and around the spinal cord, producing more space. Under general anesthesia, Dr. Hafez removed some of the bone at the base of the skull that had been squeezing Dorothy's brainstem for 12 painful years, and then removed bone that had been choking her spinal cord in the upper neck. Dr. Hafez says of the over 100 patients he's operated on, 88% report improvement in their symptoms. That means less pain, more energy, and a higher quality of life.
Okay, so if you heard that statistic, 88%, okay, they were receiving 88% of the patients who were undergoing this surgery were getting results and getting less pain, and they were able to get back to life more. So Dr. Rosner and then this was Dr. Hafez, they were working together and doing these surgeries. Well, after this aired on ABC, there was some write-ups in the Wall Street Journal, and they got quite a bit of publicity. But what happened next was that instead of trying to make this go farther forward, some of the people that were out there, they started to say, well, you can't do this surgery because it's kind of a crazy surgery if you really think about it.